Welcome to my page. Let's cover another important topic today, which is a must come in Mrcs part A. So let's start Mrcs SEO shorts. Today I'll be covering diaphragm, its major opening and their contents. So first study about the diaphragm, where it is originated from. So it has basically three parts. Sternal part, it originates from the xiphoid process. Then there is the costal part. As the name suggests, it originates from the inner surface of lower 6 costal cartilages. Then comes the vertebral part. It has crural and arcuate ligaments. The right crus, it extends from lumbar vertebra 1, 2 and 3, and the left one extends from L1 to L2. Then all these parts fuse at the center, forming the central tendon, and this is basically the insertion of the diaphragm. So what's the nerve supply of diaphragm? It's by the phrenic nerve. What is the root value of phrenic nerve? It is C3, C4 and C5. What is the blood supply of diaphragm? It is from the inferior phrenic artery. Inferior phrenic artery is a branch of abdominal aorta. It is the first branch, the first paired branch of the abdominal aorta. Let's study about the first opening. It is the Vena Cava opening. As the name suggests, the major content of this opening is inferior vena cava. Along with that, the right phrenic nerve passes through it. You should not confuse yourself with right or left phrenic nerve. So where does the left phrenic nerve crosses the diaphragm? It makes its own small opening in the diaphragm on the left side. So what is the vertebral level of this opening? It is at the level of T8. If you want to make a mnemonic for it, you can see in the word vena cava there are 8 letters. So you can remember the vertebral level as T8. Where exactly it is situated? It is situated in the central tendon of the diaphragm. Let's move ahead to the next opening, that is the esophageal opening. Now, as the name suggests, the major content of this opening is the esophagus. Along with that, both the vagus nerve, that is the cranial number 10, passes through it. Where exactly it is situated? It is situated anatomically on the right crus of the diaphragm. And what's the vertebral level? It's at the level of T10. Now let's proceed to the next major hiatus, that is the aortic hiatus or aortic opening. Now as you can see from the name itself, the major content of this opening is the abdominal aorta. Along with that, the azygos vein and the thoracic duct pass through it. It is located anatomically behind the median arcuate ligaments. And what's the vertebral level of this? It is situated at the level of T12. So in this picture you can see there are the 3 major hiatus and their contents. Along with that, there are also some minor openings. Anteriorly there are 2. On the right side we call it foramen of Morgagni, and to the left side there is a small hiatus of Larrey. So what is the clinical significance of this? The anterior diaphragmatic hernia or the Morgagnian hernia occurs through this, and there are also some posterior hernia occurs, which is called as Boctalic hernia. So this is it from the diaphragm and its contents. There will be 1 or 2 SEO short questions in the coming Mrcs part A exams. If you have any doubt or if you want any video in particular, please let me know in the comment section. Thank you.